going to be kicking off the webinar today. Before we get started with our first panelist, I just want to remind folks that this webinar is being recorded, and a PDF of the PowerPoint presentation as well as a link to the recorded webinar will be distributed via email to all the people who have registered for today's webinar. Additionally, you may submit your questions as we go throughout the webinar by typing them into the questions box. So please feel free to submit those questions as we go, and we will get to those at the very end. So with that, I would like to pass it over to our first panelist, Wendy Peters-Moschetti.
Great, thanks, Alex. Good afternoon, all barely, everyone. This is Wendy Peters-Moschetti. If you go back one slide real quick, Alex, sorry. Just wanted to welcome you all. It's a long title, so I need it in front of me. Just to welcome you all to the second webinar in our three-part series of fostering community-led, action-oriented coalitions that change community policies and conditions for health, research tools, and case studies from the field. So this webinar is going to focus mostly on that middle part, the tools piece. So you can advance. Thanks, Alex. This is me, Wendy Peters-Moschetti. We will have contact information again at the end. Next slide. Just, oh, back one. Sorry, Alex.
Sorry about that.
Just wanted to let you know we have a short and sweet agenda. All three of our webinars are lunchtime 30-minute webinars. Hopefully you all were either on or received a recording of our first webinar with Dr. Jill Litt 2 weeks ago. Please email me if you were not or if you want a recording of that email. Today I'm going to spend just like 2 minutes talking a little bit about the Colorado Food Policy Network, the sort of the force behind this webinar series, and then give it straight to our presenter. So our presentation today is called Partner, a tool for collecting and utilizing data to build, manage, and evaluate networks. And our presenter is Dr. Danielle Varda. As it says here, she's an associate professor at the School of Public Affairs at UCD. She also has an appointment at the Colorado School of Public Health. She is a co-director of their nonprofit concentration there. And I think why she's on the phone with us today is a lot of her work really gets at the heart of what food policy councils and coalitions are really trying to do across the state, and that is to build strong coalitions that bring in many different voices. And her research has specialized in collaborative governance and network leadership, specifically in public health systems. And she's done this extensive research looking at evaluating different network structures and interorganizational collaborations between public, private, and nonprofit, and all of that sort of magic sweet work that we all are kind of trying to do with coalitions across the state. So we have her on the line. So before we pass it off to her and do her presentation and Q&A, next slide, please. Just a brief background on sort of the group. Obviously, in partnership with LiveWell Colorado, this webinar series is hosted by the Colorado Food Policy Network. It is a network of local food system coalitions and the State Food Systems Advisory Council. As you can read here, we have drafted a shared purpose to promote healthy, community-based, economically viable food systems in Colorado that ensure all residents have access to affordable, nutritious food. You can also see on this slide here some of our approach to our work. That top bullet point there that really gets to why we do things like this webinar series is that what we have heard from local food coalitions across the state is really a desire to really improve the capacity and impact of coalition work at the local level. So hence we have this sort of three-part webinar series that's trying to bring some research and tools to more of us about how we really do build strong coalitions that can impact policy change at the local level. So with that, I'm going to, next slide please, we're going to pass it off to Dr. Varda, and she will take it from here. Thanks, you guys.
Hi, this is Danielle Varda from the University of Colorado, Denver in the School of Public Affairs, and I just want to say thank you for this opportunity to talk to everyone today. I know that my good colleague Jill Litt presented last webinar, and I wasn't able to attend that one, so I'm going to try to follow up a little bit on some of the things she mentioned as well. I realize right now, as Wendy was introducing me, I have a different title than the one that we actually submitted. So I am going to talk about Partner today, specifically a tool that's useful in the measuring and assessment of the coalition work that a lot of you are involved in already. So I'm going to go through this pretty quick. It's a short webinar, but I'm available for questions and follow-up, and I'm going to give you some resources along the way for that. All of us are here because we're engaged in the network way of working. It's kind of the way we refer to this coalition work. The reason I bring this slide up right in the beginning is because a lot of you might be familiar with it. It's kind of a popular slide of a network that folks use in public health presentations. But this is really the way that I'm going to frame and talk about this work today is about our work as actors within members of networks and the relationships between them. So this is just a conceptual image of the public health system and how we're no longer siloed, how connections are made between us. But we are working in the network way of working almost whether we choose to or not, because our funders and our legislators and just the cultural change in organizations have suggested that this is some improved way of doing our work. So in order to do that work, we actually need some new concepts and tools to assess these systems. So the reason for that is that we need to provide additional ways to evaluate partnerships. The current assumption, and I've been using this slide for 10 years, and it's still a current assumption, is that more is better, meaning that more partners equals somehow successful collaboration. Some folks call this counting noses, meaning that what happens is, for example, a grant is made to a coalition or a group. Let's say they come together and in 6 months they need to report their progress, or maybe a year later, and what they do is they end up listing partners. And so what happens is the only way to really show progress is more partners and more meetings. So as a network scientist, I know that this is actually a really kind of detrimental way to run a network because we are resource scarce, and it's not realistic to just increase the number of members and number of meetings thinking that's the way that we're going to achieve better outcomes. So an alternative assumption is that less can be more. So what I'm going to talk about today and frame today is not really based on how many partners you have, but how they're connected. So I like to use these pictures at the bottom to start getting everyone on the phone thinking like a network scientist right away. So for example, in this picture on the far left where the red node is, so imagine that's you, and you are embedded in your own social sub-network. So those are all of those connections that you have to people that are, we call them strong ties, people that are a lot like you. So imagine the people that you hang out with on the weekends or that you choose to be with, things like that. We're all embedded in our own social sub-networks, but what's happening is there's tons of connections and ways to connect across them. And so as an individual, this is probably okay. That's just the way things are today, and it actually feels good to have all these connections to all these diverse folks. But as an organization, now imagine that little node that says you is you and your organization, and you are embedded in your own group of organizations that are strongly connected, but now we're being told to engage in the network way of working and engage with other networks across boundaries here. There's a guy named Mark Granovetter, who did some work, and he came out with this theory called the strength of weak ties. And the idea of the strength of weak ties is that when we connect to folks who are different from us, those who are connected through weak ties, we get some advantage, collaborative advantage to diverse populations and ways of thinking that we might not be able to think of if we're surrounded by people a lot like us. And so there's a lot of reasons why we engage in these weak tie networks. But if we are an organization and we're engaged in this, like it looks like in the picture on the left, there's some problems because we don't have the budgets, the relationship budgets in our organizations to maintain networks at that kind of increasing complexity and increasing frequency. So the picture in the middle shows a different type of network. It shows one connection to each of these sub-networks. So that's called, we call that, there's a guy named Ron Burt who says, fill your network with these structural holes. And what you're doing there is you're reducing redundancy and in turn increasing efficiency and effectiveness. And so what that enables you to do, if you look at the picture on the far right, is create new relationships to new sub-networks. So you're getting that advantage of the strength of weak ties, but you're doing it in a different way. That way is more of with a management, a strategic approach. So what I'm going to talk about for the rest of this is how to use a tool to do a couple things. One is to shift your thinking so that you think about the kinds of relationships that you're in as things to manage, as things to build strategies and action steps around. It's not that we're just going to go forward with network way of working just naturally. But the only way to do that is with data. And so what I'm going to present to you is this tool to collect data. But this is the end result of the work that I do with my partner team as we try to help people think about taking their data and turning it into action. All right, so this is my only slide. The method that we use is called social network analysis. only slide on this. Social network analysis collects data on who's connected to whom, how those connections vary and change, and is really focused on patterns of relationships. There's things in networks called nodes, and those are interesting things we collect data about. They can be individuals, organizations, departments, or teams. They have attributes. So any of those attributes help us explain and understand the relationships. And then there's the ties that we measure. So the ties can be directed, undirected, valued, or binary. For example, in this picture on the right, let's say we asked everyone in here to indicate who they was a friend of whom, and here we would have seen that Garth said he was a friend of Bill. Maybe Bill didn't say he was a friend of Garth because he didn't think Garth was a friend, they defined friendship differently, or he didn't answer the survey. But regardless, we can see the relationships because of those lines. All right, that's all I'm really going to say about SNA, though, because it's not really a call about that. But like I mentioned before, we use SNA and that data for quality improvement or to manage networks. So while it's exciting to have pictures of your networks and exciting to have data, there really needs to be some process by which you have an idea of how you'll turn that data into action. So we have a methodology that we've published through my team, which we do refer to as a quality improvement methodology. And the way that we work with communities is typically we don't just measure their networks and give them network scores. Instead, we spend some time helping them identify their ideal network. And then we go in and we measure the actual network using Partner or whatever SNA tool you might have. And then what that allows us to do is identify a gap between the actual and the ideal network. So that allows you to create action steps to get closer to that ideal network. So this is just one methodology. A lot of people feel like when they get network data, it's confusing, and it should be. It's complex systems data. It's not something that's intuitively understandable to us. So there takes some learning, but what's really important is that you have some way to interpret the data that makes sense for you within your community. There's no score that you can compare your network against all other networks. There's only your network against your own goals. And I truly believe that because each network has its own backstory and its own set of conditions that make it special. So now I'm going to talk just a couple of slides about Partner. Partner stands for the Program to Analyze, Record, and Track Networks to Enhance Relationships, and here's the website. With support from the Robert Wood Johnson Foundation, we created this and launched it in 2008, and it's a tool designed for practitioners primarily to be able to engage in this kind of data collection and work without necessarily having to hire folks to do it. We've created a ton of resources for you to actually do this work on your own. Lots of people still hire us to do this work for them, but we've tried to make it easily accessible and also affordable for folks. It's a low cost. We charge public agencies $50 to use it. It used to be free, but Robert Johnson asked us to create a sustainability plan, so we've done that. Partner has over 600 users in 50 states and over 29 countries. About 80% of those are in public health, but we have people who use it for education policy, environmental policy coalitions, looking at social relationships in a classroom, at summer camps. We've really just, there's nothing about Partner that's specific to public health. It's just being funded by Robert Wood Johnson. That's been our primary audience. It includes a validated survey, which is a lot like what you know when you use something like Qualtrics or SurveyMonkey. It's a survey system. We do have 18 questions in there, and you can add that are kind of structured questions that are network relational for the most part. You can add any number of questions you want onto the end. And it links to an analysis tool. So that's what makes Partner pretty special, is that it links, once you send out your survey online, you get the data back and you put it into your tool and you can start analyzing it. For $100, we do reports for people that are kind of generic for us. We do them all the time, but we try to make that save people about 40 to 80 hours of writing a report up. But we basically have made it so that there's no data cleaning. There's really no messy work in between sending out a survey and putting it in there and starting to look at your data. And so you can go on the Partner website, and there you can find a technical manual, web demos, dissemination templates, teaching simulations, all kinds of different ways to learn. So before I show you a couple of examples of what it actually does, I just wanted to go through this so I don't forget. But if you want to know more about actually how to use Partner and so on, we do a free web demo just like this once a month. Well, now we do them about once every other month because we have some recorded ones. The next one is April 30th. This is the email address you would reply to sign up for it. We also have a number of webinar series ourselves. So one that's coming up is understanding and using complex systems data. We've realized people really need some basic skills for understanding complex data. So we're going to do that, and we don't have our date set for that. But we also run a monthly webinar called Practical Applications of Systems to Conduct Evaluation. And that's I've been running with some folks from the American Evaluation Association. And then lastly, one last resource. If you like this kind of stuff, we run a 3-day workshop called the Network Leadership Training Academy, and people come from all over the U.S. and the world actually for this. And it's right here in Colorado, in Denver, for folks who are local. But this is a place where we come and just learn and talk about all of this stuff, and it's a really fun kind of experience. So I wanted to give some resources before I just go through 2 practice examples. So where would you use partner, but kind of more even importantly, where would you use this method and these kinds of approaches? So the first practice example is one using complex data for systems building. So I'm going to talk about a group called Wonder Babies, and Wonder Babies is a partnership that works around building the system of care for babies and young children with special health care and developmental needs. So as most of you will know, the problem that this group faces is that and this population faces that there's a complex systems that families have trouble navigating, and it's very overwhelming. So we approached this work together with Wonder Babies using the partner tool to answer questions like, just very basic, who's a part of this system, how are they connected, are they coordinating services, where can we improve the system to better serve families. So in our original approach, the outcome was the network. And what we found was this strong, well-connected network. You can see a picture of it here. As expected, there's a core group of agencies that work well together. There's lots of partnerships that were described. And at the end of the day, we were able to look at some really interesting things. For example, we looked at the mental health network within that system of care and said some things about that. We looked at networks by county to look at how different they were at the urban and rural level. But ultimately, what happened was families, when we brought this information to them, they continued to show a fragmented system. So this is a picture of a mother who kind of drew out her network of her system of care for her twins with special health care needs. And despite the fact that our systems level results were showing such positive things, meaning that, you know, when we used the network analysis, we showed lots of meetings, lots of connections, and so forth. It wasn't really resonating with anyone who was deeply involved in the system. So what we realized is that we needed to do something different. So we shifted the use of our partner tool a little bit, and we now have something we call the Patient-Centered Network Survey that we give out, and we give this to families. And in this way, the outcome now is the family's personal network. We realized that our large system, what we were showing there, are kind of accomplishments and some benchmarks, but not really an outcome. So instead, now we look at the system versus the family networks, and our outcome is the personal support network. So this was so interesting for us. When we gave out our survey to the system, we had tons of people, you know, listed all kinds of partners, and no one in the whole survey of 100 respondents ever listed families as one of the nodes and members of the network. When we asked family members about who were involved, who was a part of their system of care, this is kind of cut off here, but you can see that there were some real differences in who the top 10 key actors were. So for families, it's things like pediatricians and schools and other families and extended families. However, at the system level, it's all the state agencies that showed up as the, you know, the key members, the most influential brokers and things like that. So one thing we learned that was happening is there's a real difference in the conversation that was happening between the systems level folks and families. And families just don't connect with that system in the same way. So families tell us repeatedly that they don't really care what's happening at the systems level. They just want to be able to navigate it easily. So what we've done with that, one more finding. We actually, when we asked families about their personal networks, we did find that they rated their networks as being very important to their children, providing support and trust, but not working well with others or talking together. So even though they had strong support networks, they're not very well coordinated. So what we've done with that is interesting. So now I really like to talk about using network data to translate into practice. And so this is one good example we have of that. You know, we realize that if the system is coordinated, wouldn't families say they're outcomes, their networks were coordinated as well, and that's not what we're seeing. So we have this patient-centered network survey that we're turning into an app. It collects data on the patient social support network, but we're trying to use research to turn it into a screening tool that can be used by a provider, so any kind of provider, in order to help them understand the degree to which a patient's social support network is weak or strong. We even have a cancer hospital that's interested in this and interested in looking at social support networks of their cancer patients to kind of understand how well they can provide their own home care. So that's how we really turn the whole network approach to our coalition and systems work into something that's really actionable. And so we're really in the early stages of the app in that place, but that's what we're doing with that. And then one other example, besides translating data into practice that I think is important to talk about, the other thing is how do you communicate data to your constituents, to your stakeholders. And it's difficult. If I come back and I start talking about dyads and whole networks and density scores, people get really confused. So here I'm just going to show you another example of how we communicated some complex systems data into simple terms. We work on a project with the home visitation work happening in the state of Colorado around McZ. And what we did is we gave surveys out to 12 early childhood councils in Colorado. So these are the councils legislated to coordinate services and programs and processes for folks working in early childhood areas. And we gave them the same kind of, we gave them the partner survey in just its very truest form. We did some quality improvement work with them on improving their systems. But this, I hope you can see, I decided to just show what we produced at the end. And this is a document that basically was a 3-pager. This is for Mesa County, whose permission we have to share this. And basically, this was what we call a highlights document. So this is one way that we translated some pretty complex systems data into something that people can understand. So I'm actually just going to kind of read this a little bit, but basically what we did is we said in 2014, 36 organizations answered questions about how the Mesa County Partnership for Children and Families has strengthened the early childhood system, and here's what they told us. So this is something they can hand out to their partners. PCF is their early childhood council, and basically the 36 organizations identified, we told them, 591 partnerships. And of these, they reported that 63% of them were attributed to activities related to the ECC. So what that meant is we asked a question in the survey that said, do you have a relationship with a certain partner? And if you do, did the ECC help create that relationship between the two partners? And if not, did it help, if it already existed, did the ECC help strengthen that relationship? And overwhelmingly, people said that their relationships were either created because of the ECC or strengthened by the ECC. So the reason this very simple number is so important is because the state of Colorado is legislating these ECCs. And there's a lot of questions, and there's always questions about to what degree is a system or a coalition making an impact. Well, in this, one of their charges is to build the system and to create relationships. So here, what we've done is we've taken all those anecdotes that people are always talking about and how well the ECCs work to create partnerships, and we've added numbers and some quantifiable work behind that. And we feel like, and we didn't even expect it to be this, to show this much success. And so we feel like if we aggregate these numbers across the state, we're going to be able to show how these ECCs are building up the system in ways that we would never be able to show without a measure like this. We go on to ask, what those relationships did, and then we have some numbers about what they resulted in. And you can see there's 3 pages, and I'm only going to show 2, and that's kind of the end of what I'm going to talk about. But what's really important in all of this is that we have now a way to demonstrate that we are what they're doing. And what's been really important to us, it took us a couple iterations to come up with this document, is that we communicate the work of these complex data that we're collecting in a way that really can be understandable to people. And so it's going to take the hard, complex work of collecting the data using a survey like Partner. That's always going to be hard because it's a complex system. However, there are ways, and that's what we kind of hope that we're doing, is helping people really translate these back into practice. So these are just a couple of examples that I wanted to share today with what we've been doing with the Partner tool. I'm not even giving Jill's project as an example because I think she did. So I think I'll just end there and see if there's any questions.
Thank you so much for that. We don't have any questions coming in yet, so feel free to submit those. Wendy, do you have any questions for Danielle while we're waiting?
Hi, thanks. No, I just want to say thank you so much. I'm geeking out a little bit, to be honest. This is a wealth of amazing information. I want to remind folks that we will be emailing out these slides in this recording. And I think what's great is that you also flagged some very obvious next steps. So for those of you on the line and not, remember there's a slide in the middle that will have information about additional webinars that Dr. Vonda and her partners are presenting, and obviously this very big training at the end of May. So there's lots of ways to continue to be involved, as I'll call people's attention to. So I can also just do my closing slides really quickly to give people some time to type in questions.
That would be great.
So just, obviously there's our contact information is on here. If you have questions about the Colorado Food Policy Network or local food policy councils or the State Food Systems Advisory Council, you can email me with those questions. I provided a link here to the Colorado Food Systems Advisory Council website. On that website there is an inventory of local food policy councils or coalitions across the state. We also, through the Colorado Food Policy Network, have a Facebook group. I think it's very active because I'm posting there all the time. So if you want to see interesting posts from me and others as well, there's a Facebook group for the Food Policy Network you can join. And obviously I'm probably too often inundating people with email updates as well. So you can always email me if you kind of want to get on our distribution list. And then the one last slide, next slide that I had, it was up the last time as well. Same resources slide from our last webinar. It's just one other issue that we've been tracking, even nationally, conversations with Food Policy Council are really what other tools are out there for not only sort of building our networks, but then making sure that those networks are actually including a variety of different voices, and that perhaps creating new ways of making decisions and new dynamics in the community. So I just wanted to flag a few resources that I've received nationally of tools that coalitions have used to sort of assess the sort of membership within their networks and how to diversify that membership. So just a few resources to flag, and that's all on my end.
Great, thank you so much. We do have two questions from our attendees today. The first is a pretty quick one. Can you provide the leadership workshop link info again, the 3-day workshop that I believe Dr. Vonda referred to earlier in the presentation? Yes, this PowerPoint presentation will be included in a follow-up email, and I can call out the in that follow-up email, I can pull out that info on the 3-day workshop so that you see it right away. So thank you so much for that suggestion. And another comes from Chris. Any suggestions on how to utilize this tool when you don't know the entire sample of potential partner organizations at the start? For example, a broad set of organizations in the community. That's a big question.
Well, actually, so what you've just asked is the absolute hardest part of the work that you'll do in using a tool like this. And so if you come to a demo or see how the tool works, we have it set that the work is divided up into 4 steps. So the very first step is what we call what you just asked is called bounding the network, and then the next 3 steps is customizing the survey, sending out the emails, and analyzing the data. Of those 4 steps, that first one is the hardest, and the interesting thing is so many people kind of skip over it thinking it's not going to be that hard once they have to load up their list. There's different ways to do a network analysis, and one is to use a bounded network, and the other is to do a name generator where you ask people to list their partners. There's a ton of methodological issues with name generator, and it's actually very difficult to actually clean those. So we don't use that in partner primarily because it's designed to be automated, so you don't have to go through a lot of data cleaning. So all that said, when your question is who is a part of your network, then you do have to spend a little bit extra time. We've had some people get to that point and come back a year later after they've done that work. We have other people who come back the next day because they have a list in their hard drive. So what we suggest to people is that you try to figure out who you want to include in the network. whoever you include in the survey usually gets the survey and answers the question about one another. There's another approach where you can include people and not send them the survey. We use that example in the demo, so you'd see an example of why you would use that approach. We have someone right now who's, for example, we get calls like every day from people who have different scenarios, and right now this one's on my brain because someone wants to use it basically just to show the connections that the public health department has. They don't really have a context around that, so they're going to try to bound that list, and we've had people do that before. If you know the list and you just need to cut it down, that's one issue. If you don't know who to include on the list, we actually advise people that they should probably get like a key group of key informants or stakeholders together so that you can talk and get advice from them about who that list should have. You may want to get enough people so that you have no more new people, a kind of snowball sampling approach, but it's probably a step you take before you actually do the survey. And no matter how frustrating and how much work that is, it's going to be so worth it when you have a bounded list. Once you send out the survey, you'll see it's going to go so clean and smooth after that if you use a tool like this, that it's well worth the thinking you have to do ahead of time. So we usually work with people individually on talking about their individual situations, but we have just some kind of key like advice that we give to people, especially during the demo. But you've asked the key hard questions, so if I answer none other, that was the one.
Great, thank you so much. Those are all the questions that we received today, but as both of our presenters mentioned, they're both available for follow-up questions and conversations. Thank you all so much for joining us today, and I would like to extend a special thanks to Dr. Danielle Varda for joining us as our special guest, and we look forward to seeing you on our third and final webinar coming up I believe, the end of this month. Thank you all so much and have a nice day.
Thanks.